Once again, we are joined by Dr. Leah Croll, who's an assistant professor of neurology at SUNY Downstate Health Sciences University. Dr. Croll, thanks so much for coming back on. So when we're talking about people who are at higher risk of developing Alzheimer's, give us a sense of how genetics factors in compared to those modifiable factors.
Well, this is really interesting, Lindsay, because certainly there are certain genes that increase someone's risk for developing Alzheimer's, but having that gene isn't a guarantee. It doesn't mean it'll definitely happen to you. Then there are risk factors that are potentially modifiable. So these are things like age. The older we get, especially over 65, we're more likely to develop dementia. Women are more at risk. Blacks and Hispanics are more at risk. People with certain medical conditions like obesity, diabetes, high blood pressure, high cholesterol, hearing loss. So the whole picture of who you are sort of determines your risk. And one thing I think that's really interesting from a body of research we're really only just starting to understand is that even things like genetics and other risk factors are not guaranteed. Your behavior can still modify those types of risks.
And when you talk about behavior, things that we actually can change, is there one in particular that stands out as being largely more important?
Yes, I'm going to give you sort of a rapid fire version of what I tell my patients because there's really 5 things everyone should know. Number 1, talk to your medical doctor about what medical risk factors you have for dementia and what you need to do to stay on top of them. Number 2, physical exercise, increase that activity level. It boosts your brain health. Number 3, brain healthy diet. Number 4, socialize, really invest in social relationships throughout your life. And number 5, prioritize getting great sleep and stress management. But if I had to pick just one, I tell my patients it's that increased physical activity that really makes a huge difference for your long-term cognitive health.
And something that we can all do.
Absolutely.
When we talk about age, is there a particular time of life when we really should say, okay, I'm going to, almost as if, when you get a mammogram, there's a certain time. Is there a certain point when you should say, I'm going to really try and reduce my chances of getting dementia?
So what I'll say is it's never too late. Ideally, we would be developing healthy habits early in life and carrying them through our entire lives. Now, most people are not doing that. We're only human, right? But you should never be at a point where you say, it's too late for me, I'm going to throw my hands up. That just isn't the case. Research really proves to us, whether you're older, whether you have genetic risk, other risk factors for dementia, starting to adopt healthy lifestyle patterns will make a meaningful difference in terms of preventing, delaying, slowing down dementia.
How do you know if you're high risk?
So things to look out for, number 1, what medical factors might be there. Obesity, high cholesterol, high blood pressure, diabetes, hearing loss, vision loss. I can't emphasize enough how important these things are for your brain health. Number 2, your family history. Is there perhaps a genetic source of your risk for Alzheimer's disease and other dementias? And number 3, your lifestyle habits. And number 4, sort of who you are. As we mentioned before, women have higher risk than men. Blacks and Hispanics have higher risk than other groups. So all of these things sort of come together to inform your risk.
Dr. Croll, we thank you so much. Really appreciate it.